let's go to the last talk that will be performed by T.GUSTOT. Thanks, Thierry, for being here. Thierry had the transplantation program of Erasmus Hospital in Brussels, and he will tell us if there is an optimal time frame for liver transplantation in those critically ill cirrhotic patients.
Thanks, Manu, for this kind invitation, and I will try to describe the optimal time frame for liver transplantation in critical ill cirrhotic patient, and especially in ACLF patient. The story is like this. You have a patient with a cirrhosis, compensated one or unknown frequently, and at one time, due to a precipitating event, there is a rapid decline in the medical status of the patient with accumulation of organ failures until the threshold of futility of care and death. And then in this scheme, it's easy to think that the best strategy to perform liver transplantation is early, perform as soon as possible liver transplantation. And when we look to the data come from UNOS, from United States, clearly there is an association between the delay from the listing for liver transplantation and the survival after liver transplantation for patients with ACLF grade 3. You see on the left side the graph that demonstrates that when you perform liver transplantation within the 30 days of listing, you have a better survival compared to a more late liver transplantation. And interestingly, a recent paper published by the same team in GIAP reports suggests that during the first week of listing a patient with ACLF grade 3, you lose 4 to 5% of survival every day that you wait for a transplantation, suggesting that when you perform liver transplantation as soon as possible, you save lives. And then the response, early transplantation, maybe yes, but with which donor liver? It means that if you want to be quick, logically you accept marginal liver. Here, it's based on an index, is DRI, is donor risk index. It's a score based on several parameters coming from the graft, the age of the donor, the cause of death, the race, the donation after cardiac arrest, the fact to have a partial liver, the height of the donor, the location of the organ, regional or international, and the call time. And we define classically a marginal donor when the DRR is higher or equal than 1.7. And as you see, when you transplant a patient with ACLF grade 3 with a marginal liver, you decrease substantially the 1 year post-liver transplantation survival. And then it's a danger to choose this, but there is always a balance between the timing and the quality of the graft. And a recent paper based on a complex statistical analysis, it's based on a Markov decision process model. It's say that during the first 7 days of listing, when you have a patient with ACLF grade 3 and 3 organ failure and no more, you can wait until the day 3 to accept marginal liver. It means that you wait for an optimal liver during the first and the second day. If you don't have this, at the day 3, you can accept marginal liver. And when you perform this strategy, the 1 year post-liver transplantation survival is around 80%. But if you are in another case, ACLF grade 3 with 4, 5, or 6 organ failures, then you cannot wait because the death per day is very high. And then at this time, you can accept a marginal liver from the day 1 of listing. And in this strategy, your 1 year post-liver transplantation survival is about 70%, is lower, but acceptable in this very severe patient. But as Richard said, you must remember that ACLF is a dynamic process. It means that ACLF can improve, ACLF patient can improve, can deteriorate or stabilize. And these evolution have a huge impact on the prognosis. And we demonstrate that the best time point to define this clinical course is the day 3 to 7. And as you see here, the grade of ACF between the day 3 to 7 is more accurate to define the prognosis at 28 day and 90 day compared to the initial grade. And then it's important to manage the patient with ACLF during the first week to see the clinical course, because it can have an impact on the result of liver transplantation. And based on the literature, the rate of recovery of ACLF is a partial or complete. It's around 40 to 50%. And then it's important to base our strategy on this study that demonstrate that on the list, when you list a patient with ACF grade 3, and you see that the patient is remains ACLF grade 3, there's no improvement, then you perform a liver transplantation, you have 82% and 1 year survival after liver transplantation. But in the case of your ACLF grade 3 is improved at the at grade 1 or 0 or 2, then your survival rate after liver transplantation is higher, 82%, significantly higher than ACLF grade 3 at the time of liver transplantation. And then when you combine this with the timing, it's important to know that if you improve the patient from grade 3 to 0, 1 or 2, the timing is less important because there is no significant impact on the survival after liver transplantation if you perform the transplantation before the 7 days or beyond the 7 days of listing. At the contrary, when you see a patient with ACF grade 3 without improvement, clearly the fact to perform the liver transplantation early, before the 7 days, it's better than wait more time. And here it's also the same study that show you Richard. It's a French study, and this French study demonstrates a very adequate 1 year post-liver transplantation survival for patients with ACL grade 3, so around 84%. And as you see, when you look to the characteristics of this cohort, you see that your characteristic at the time of ICU admission compared to the time of the transplantation, you see that the patient improves. There is less organ failures, improvement of respiratory failure, and the number of organ failure decrease. And the time frame between these two situations in these studies, the median is 9 days. It means that it's very important to optimize the patient before liver transplantation to have an adequate survival rate after liver transplantation. And we can resume my talk with this graph. When you have a patient with a medical status declining very quickly, it's important not to perform liver transplantation too early, because you have a probability to have a partial or complete recovery with better results, and then you must try to improve the patient. And if you don't have this improvement, and you can assess this at 7 days, then you must perform a liver transplantation before to have the threshold of fertility of where the patient is too sick to be liver transplantation. Then you understand that this timing window is very narrow. And at this time, we have no clear or prospective study to define this window, and we will try to do our best to define it in the future. Thank you a lot for your attention.
Thanks a lot, Cherries.